Than not, premenstrual syndrome, better known as PMS, is described with one life-altering symptom: mood swings. In reality, PMS triggers many symptoms and is a recognized medical disorder. In addition to moodiness, symptoms of PMS include anxiety or depression, acne, swollen and painful breasts, fatigue, insomnia, headache or backache, muscle pain, appetite changes, and bloating. These symptoms are primarily caused by the changes in the hormone levels that happen right after ovulation, around 14 days before the beginning of a woman's period. About 85% of menstruating women have at least one symptom of PMS. Often stress and emotional problems, low levels of vitamins, and eating salty foods and drinking alcohol and also caffeine make symptoms even worse. Fortunately, you can do a lot to ease your monthly discomfort. Exercise more, eat healthy foods, get enough sleep, and don't smoke. You should also avoid salty, sugary foods and caffeine and alcohol. And go ahead, vent your moodiness, but you might want to do it in the pages of a journal. You may also want to find that certain nutritional supplements such as folic acid or magnesium ease PMS. Ask your doctor if that's a smart choice for you. Over-the-counter pain relievers such as ibuprofen or aspirin can ease inflammation and discomfort, and doctors sometimes prescribe birth control pills to relieve severe PMS symptoms. If every month you feel a wave of despair, panic, anger, or lack of interest in activities, see your doctor, because you might be dealing with a form of PMS called premenstrual dysphoric disorder. It's a severe form of premenstrual syndrome. The symptoms of PMDD are similar to those of PMS, but are severe enough to interfere with work, social activities, and relationships. PMDD occurs in 2% to 10% of menstruating women. Women with family histories of premenstrual syndrome or PMDD are at greater risk for developing PMDD, as there appears to be a strong genetic component. As with PMS, the exact cause of PMDD is not known. Recent studies have shown a connection between PMDD and low levels of serotonin. Antidepressants are generally used to treat this very debilitating condition. If you have any of these symptoms, make sure you check with your doctor. I'm medical editor Dr. Corey Hebert with your Weekend House Call.